I'm Dr. Akshay Ranade. I'm an MDS in Oral and Maxillofacial Oncology. Plus, I deal with aesthetic dentistry, digital smile designing, and implantology. Basically, I'm also a fellow in clinical research and a tobacco intervention initiative leader for WHO as well as Bloomberg Initiative and Indian Dental Association Head Office Mumbai branch. My connection with Udaan is through Dr. Anil Lunia sir, and under his able guidance, we are about to launch a project as regards to oral health care. It has a wide approach and this comes under the sponsorship of Udaan Welfare Foundation. This particular project will be held initially in one of the colleges in Ghatkopar, where we would be catering to around about 6,000 to 7,000 girls. It is basically a junior college and a senior college. Here our approach would be firstly is to treat them, to diagnose the oral diseases or the caries or the periodontal diseases, and to treat them under primary care, also maybe secondary care. Then to train these particular students, if they wish to, into becoming career-oriented dental hygienist or dental assistants or dental mechanic, so that they will be empowered. These girls will be basically empowered to have kind of self-employment for themselves. And the third thing or the third objective for this particular project is to adequately educate the girls as regards to the tobacco addiction and the tobacco misuse and the abuse of this particular substance. WHO has categorically mentioned the Empower system of tobacco de-addiction, and since India being a country where you have a lot of havoc being played by the chewable form of tobacco, which cannot be that way monitored, because our country is more of 60% dependent on chewable tobacco and 40% only on the smoked tobacco, that is the cigarettes, whereas in case of Western countries it is more of the smoked tobacco. So here we have a prevalence, wide prevalence of oral cancer, oral submucous fibrosis, then other pre-malignant conditions related to tobacco use. So if we can educate these girls through a proper medium and through a proper training, we can help to establish a tobacco-free society as far as menace of tobacco is concerned. Also, these girls are the would-be women of our Indian society, and if they are educated more, like what we used to do with Alcohol Anonymous, the entire family gets educated. Automatically their kids or their husbands, respective husbands, would also be educated in a similar manner. So this is like it's a cascade. It's basically building up of a triangle towards oral healthiness. Basically, we would like to appeal to all those who are going to support us or who have supported us in this particular project, having oral health awareness as well as tobacco de-addiction, as well as maintaining the primary health of oral health of the society. We are starting it at a grassroots level, so we would like to have as much help in terms of the money as well as in kind as far as the sponsorship is concerned for this project, because this we would like to network it, because unless you network this project and you go to and you reach the masses, you cannot actually eradicate the menace of tobacco. We would like to make a sincere appeal as to all the sponsors to come forward and generously donate whatever they can and help us in our endeavor, so as to make this society tobacco free and also increase the primary health, oral health care index of the society. And this in turn is actually going to make our society much more healthier, and plus to empower the females or the women of this society, so as they become self-independent or they become independent in whatever future endeavors they would like to undertake. So it's basically a four-pronged approach encompassing the oral health care, primary care, preventive care, tobacco de-addiction, and women empowerment.